Welcome back to the American College of Surgeons, bulletin brief from the frontline surgeons' voices. And today we're going to speak with two young surgeons, continuing our conversation about the upcoming annual clinical congress, Doctors Jessica Burgess and Daniel Eiferman. Dr. Burgess, just tell us a little bit about where you practice and the nature of your practice.
Sure. I'm an associate professor at Eastern Virginia Medical School in Norfolk, Virginia, and I do general surgery and acute care surgery.
And Dr. Eiferman.
I'm an acute care surgeon, surgical critical care at Ohio State in Columbus, Ohio, also with an interest in abdominal wall reconstruction and lymphedema surgery.
Great. So lots of varied interests. As acute care surgeons, you really do need to know the gamut of everything done in surgery by all of us, colorectal and vascular and everybody else. So first question, Dr. Burgess, when did you become a fellow of the college, and were you a frequent attendee at meetings prior to the virtual 2020 Congress?
Sure. So I was a member of the Resident Associate Society in 2015 and then became a fellow in 2017. I've been fortunate to be able to attend most of the colleges in person since my chief year of residency in 2014. And so, yeah, I've been a regular attendee for the last 8 years now.
How about you, Dr. Eiferman?
I became a fellow the first year I was eligible, so I became faculty in 2010 and joined the college the next year, and have been a frequent attendee of the meetings virtually every year since I've been faculty.
So speaking of virtual, while you have the microphone, Dr. Eiferman, how did you enjoy the 2020 virtual meeting?
So I actually got a lot out of it by being able to see the meetings at my own schedule. Meaning one of the more frustrating things of in-person meetings is when there are two concurrent sessions that are both interesting to you, but obviously you can't be at two places at once. I thought the website was extremely user-friendly. That allowed me to highlight the sessions that I was most interested in and then watch them on my own time. I thought the college pulled it off very well.
Great. Dr. Burgess, did you avail yourself of the content after the actual annual clinical congress?
Yes, sir. Yeah, it was excellent. Not only was I able to watch it live and the sessions I was most interested in, I was able to, do the live chat portion and ask questions. But then it was also excellent. We were able to pick out a handful of sort of our favorite sessions and lectures to share with our residents as part of the educational program over the upcoming months. So it really was a great way to get the information and be able to utilize it on your own time and schedule.
Great. And what are you looking forward to in this year's program, Dr. Burgess?
I think mostly the variety of topics. There's a lot of great topics this year on acute care surgery and developing your own acute care surgery program. And also just the variety, like Dr. Eiferman mentioned, sometimes when it was in person, you would have to, pick and choose your sessions. But this year, I really think I can look into a lot of topics that normally I wouldn't have necessarily had the time to attend. So I'm looking forward to getting a broad range of information.
Dr. Eiferman, anything particular grab your fancy looking at the advanced program?
One of the things that I really like about the college and the clinical congress in general, I think they do an excellent job of talking about and hitting on not necessarily like surgical technique or updates in disease management, but how we take care of ourselves, how we build a practice, how we communicate with each other, how we grow our resiliency. There's several excellent sessions on those, some of which I've been able to be a part of in the past. I think those are excellent sessions for all surgeons, regardless of year, including residents. And I think the college just does a great job of highlighting that better than any other society that I've seen. And this year's Congress is no different.
Great, very good point. So let's pretend that there are some surgeons who worked with you at OSU who are not really planning to go to the virtual clinical congress. What do you tell them? What's your elevator pitch for them?
My elevator pitch to them is that the college does an excellent job of hitting what is relevant in surgery today, and with the broad range, that there is something out there that will make you a better doctor and a better surgeon. And again, with it being virtual, this can be on your own time. So go the website with the being user-friendly as it is, just go through and click what you want to see, and you can get something out of this Congress.
Great. Dr. Burgess?
Agreed. I think, currently in the era of COVID, we're all having to do our continuing education and keeping up with the latest research a little differently than we used to. And I think that definitely the college provides the best and most user-friendly platform for it. And just looking at the program, there's so many different topics to pick from that you can do in little snippets on your own time. So I think, again, when we're looking to figure out how we're going to get continuing education, I think the college is the way to do it, and gives you, sort of the most bang for your buck.
Great. Do you think there's any deterrent because there is a registration fee this year as compared to last year?
I don't think so. I mean, certainly, you get what you pay for, and you're getting, a great educational curriculum, and again, being able to do it on your own time. So I think, hopefully it shouldn't be. We're not using nearly in the amount of continuing education money that we've used in the past, since there's no travel expenses. So hopefully a registration fee wouldn't be a deterrent.
Great. Well, I look forward to seeing you both in the virtual platform this year, and hopefully live in San Diego in 2022. Hopefully we'll get back to live annual clinical congresses. So thanks both for your time today. I know you're both busy at work and on the way to work. So appreciate your indulgence and sharing your reflections with us.
Thanks for having me.